All right. Well, good evening, everyone, and welcome to our temporary foreign worker information session. My name is Jeff, and with us tonight is Dan. Hi, Dan. How are you? Awesome. We want to thank you for joining us. We are very happy here to be here tonight to talk about a very important topic, COVID-19 vaccines, which are in the news every single day. We want to really spend some time um, with our key audience tonight is such a huge part of our food system here in Chatham-Kent, and we have such a vast array of people from all around the world coming and working hard in our community. So please thank you for joining us for tonight, and we hope that we can give you some answers that you're looking for to make really good decisions for you, yourself, and your health. So our main presenter tonight is Dan Juilliard, and he's a public health nurse here with us at CK Public Health. Dan, you've been a public health nurse 10 years now, is that right?
Yeah, going on 10 years almost. Yep.
Okay. It says here that you've kind of been on our vaccine team for the last 5 years. So you've been working hard this whole pandemic on this topic. And Happy Nurses Week, by the way, as well. That's this week. Is there anything else you want the audience to know about you?
I mean, not much. Just I'm a regular guy, born and raised in Chatham, living in Blenheim now. And I've got 2 little kids at home. I live with my wife, and when I'm not working on vaccines and trying to help bring this pandemic to an end, I like doing some woodworking in my shop and fixing things around the house and keep my hands busy and my mind busy, that sort of thing. But I'm here tonight to talk about vaccines and to hopefully answer some questions and help people feel a little bit more easy about getting their needles. So.
All right, for sure. And I definitely look forward to what you have to say tonight. If it's okay with you, let's go over the format a little bit tonight. We are on YouTube Live, so if you missed something, don't worry. It'll be on our channel later, and you can catch up for some of the things that you've missed out on. So up first, you're going to kind of do a brief overview, kind of some of the most frequently asked questions that we kind of get. We get hundreds and hundreds of questions every day that all of our staff have been kind of working away to kind of help people make informed decisions about vaccinations and among other topics as well. So as you're presenting, we really would like you to send your kind of questions into us. And there's 3 main ways you can do that. And so let me add that here up onto our screen. So there's 3 main ways that you can participate tonight. So please, in the comments box in YouTube, submit your questions in there. Now, keep in mind you have to have a YouTube or like a Google account. So that is important. If that doesn't work for you, you can always email it to us right now, and I'll be watching for those emails to come in. And also, and I'm going to drop this right now in the comment section, is you can text your questions in using WhatsApp. So that is all available to you. Hopefully, if you have any questions as well, just let us know. So without further ado, I'm going to step behind the stage here, Dan, and you can take over if that's okay. Thanks, and please submit your questions, and we'll get to them, and we'll try to give you as much information as we can tonight. Okay? Are you ready, Dan?
Ready when you are, Jeff. All right. So, like Jeff said, I'd like to welcome everyone. Thanks for joining us live if you're here tonight. If not, if you're watching this pre-recorded session on YouTube later on, thanks for seeking out the information. I hope there will be some things in here that you'll find useful and that will help move you towards a decision to receive your COVID-19 vaccine. So the session tonight, like Jeff said, is specifically targeted towards our temporary foreign workers. They're definitely a key part of our food production here in Chatham-Kent. And I know you come from all over the world here, and we want to make sure you're taken good care of and protected while you're here so you can return back to your families when the season's done. So the first thing I want to start out by saying is the COVID-19 vaccine is not mandatory. Nobody can make you take it if you don't want to. Of course, it's very strongly recommended that you receive it to protect yourself, your family, general community around you. It is the best protection we have from COVID-19 right now, but just to stress that nobody can force you to take it, and you can't be fired or refused work or anything like that if you don't get vaccinated. So we'll get that out of the way first, and then we'll move into a little bit more specifics on the vaccines here. So why should you get the COVID-19 vaccine? Why should anybody get it, really? We know this pandemic has really brought things to a standstill and affected our normal everyday lives. This virus spreads very easily indoors, and especially when people are close together. This includes places that you guys live, guys and ladies live and work, like bunkhouses. I know you travel in vans and trucks to get to and from fields and whatnot, and even the stores and other public places you do your business on your off hours. There's all risk to acquire COVID there. So those are all great reasons to get vaccinated. And so now I'll just talk a little bit about how vaccines work. So there's a lot of fears about different things. We'll get into a little bit later about, do the vaccines change your DNA, all that sort of thing. But let's get down to basics. So the virus itself is basically just a ball with a whole bunch of spikes on the outside of it, and it has instructions to make new viruses on the inside of it. Now, these spikes on the outside I mentioned, they're like fingerprints, and every type of virus has its own unique fingerprint, if you will. So next slide, please. Now, the vaccines, they only have the information in them to make the spikes. So remember, I said the virus has instructions in it to make more viruses. The vaccines only have the instructions to make those spikes, or the fingerprints that we want our body to be able to recognize. So when you get the vaccine, your body will learn what those spikes look like. It's like hanging a wanted poster in your body, so it's on high alert to look for this specific thing. And it'll learn how to fight off those spikes without the worry of more viruses being made and your body not being able to keep up with it. So that's really the purpose of vaccines, is to let your body identify and be able to fight a new virus without having to worry about being overwhelmed and getting very sick from the virus. And that's really what the goal is here. Next, please. Now, sometimes when your body is fighting off those spikes or learning how to, you might feel sick a little bit, even similar to symptoms of COVID-19. And these are things that we call side effects. Side effects are normal. They happen with almost all vaccines and medications. Some people might not experience any side effects. Some people might only experience one or two, and some people might experience more. So it's important to know that it's not a sign that the vaccine made you sick or gave you COVID or anything like that. It's actually a sign that your body's working, your immune system is doing what it needs to learn how to fight off the virus, so that if you ever do get the virus later on, your body will already know what to do with it, and you shouldn't get as sick, and the sickness should not last as long. And we're hoping that you won't be able to pass it to anybody either. So all great things, great reasons why you should get this. A little bit more about the side effects of the vaccine. People always ask, well, what can I experience afterwards? And like I said, these things usually last shorter and are less severe than if you got the disease itself. So commonly people will report maybe pain, little redness or swelling where the needle was given. Might feel tired for a couple days, maybe a headache, muscle pains, chills, joint pains, even a low fever. These are all sort of common cold and flu symptoms that we recognize and experience. And feel free to take Tylenol or Advil or anything else you normally would to help relieve those symptoms. And keep in mind that it's your body revving up and fighting hard to recognize that virus and be able to fight it off if you ever run into the real thing in the real world. Next, please. So I mentioned that a few of the common questions we get are things like, can the viruses change your DNA? And the short answer to that is no, that's not true. So the place where the spikes are produced for our body to fight off are not in any part of the body where our DNA is stored. So the actual vaccine information and our DNA will never come in contact with each other. There's no risk of change to our DNA or to our genes by being vaccinated. Some people have concerns about ingredients, which is absolutely understandable and something that you should pay attention to. So a lot of vaccine ingredients in the COVID-19 vaccines are things that we actually already ingest, whether it's food or some cosmetics we use and put on our bodies, and in our bodies contain some of these things. And specifically, it's things like fat-coated mRNA, which that's just a fancy term for the instructions for the spikes that I was talking about earlier. It has some salts, some sugars, polyethylene glycol, and water, among certain other things. But the purpose, every one of those ingredients has a purpose, whether it's to allow the body to take in the vaccine better, whether it's to make the immune system respond better. There's a purpose why those ingredients are in there, and they are safe, and they have been tested. They don't contain things like blood products. These vaccines don't contain preservatives. Some people say that they're afraid that they're made from fetal cells from basically aborted baby fetuses, which isn't true. And it doesn't contain microchips, contrary to popular belief. Important to note, these vaccines also don't contain other common allergens like latex. The people that made them wanted to make sure that the most amount of people could benefit from them, so they made sure there was no latex, not even in the container that the vaccines are stored in. So that's all great news. Next, please. Oh, thank you. So speaking of serious allergens like latex, you want to pay attention to the vaccine ingredients, because if you're allergic to any of them, you're not going to want to get the vaccine. And that's basically the only reason there is to not get this vaccine, is if you're allergic to any of the ingredients. So just a little bit of insight onto how often allergic reactions happen. So there's about 38 million people in Canada. And if we gave everybody this vaccine, which, I mean, we're hoping to, only about 76 to 95 people, so around 100 people out of 38 million would have a serious allergic reaction. And to compare, if we gave a common medicine like penicillin to everybody in Canada, there'd be about 4,000 to 15,000 serious reactions. And I don't think many of us would give a second thought if we were given penicillin for something to help us feel better, unless, of course, you had an allergy to it. But that's just a little bit of insight as to, yes, even though we talk about vaccine reactions, we want people to be informed about getting their vaccination. In actual fact, these occur very, very rarely, and it should not be a reason why we choose not to get vaccinated. Now, we do take all the precautions, though, if someone does have an allergic reaction. One of the ways we do that is we ask people to stay in the clinic area for 15 to 30 minutes after their shot to make sure that they're not having a reaction. Normally, if an allergic reaction is going to happen, it happens that fast, and then we have people and processes there to make sure that you can be looked after properly, given proper medication, taken to the hospital if you need to be. This is extremely rare, like I said again, but we do have all the procedures in place to make sure that we can respond to that if it happens. There's nurses and paramedics at every vaccine clinic, so let them know if you ever feel unwell for any reason, and they'll make sure that you're looked after. Another concern people have is how quickly the vaccines were made, which I can completely understand. So no, the vaccines didn't skip any approval steps or safety steps to get out faster. In Canada, for sure, it's illegal to sell or market vaccines or medicine that haven't completed all stages of research. Another reason why this vaccine was developed so quickly was because a historic amount of money and research went into these vaccines. We had scientists and researchers from all over the world and donors from all over the world giving money and putting effort and time into this, which never happens for any other vaccine, really. And the research and testing happened at the same time instead of one after the other. So normally when a vaccine is developed, they'll do research and then they'll send that information for people to look at and sort of review. And then once they get a response back, they'll do more research and advance it, and then so on and so forth. With when they made this vaccine, the researchers did their research, sort of sent it for analysis, and then went right back to doing further research to move the steps along. So it was just a little bit of a different way of doing the process, and then the amount of money and time that went into this that really allowed the scientific community to give this to us in less than a year since the pandemic started, it's incredible. And they're really good vaccines too. So next. Yeah, I forgot. There's a couple more reasons why the vaccines came out quicker, and that's because more people signed up to test the vaccines than normally do for other vaccines. So for one of the first vaccines that came out, there was about 40,000 participants that signed up to get these shots to see if they were safe and effective for the rest of us, and that's more than twice the amount that they would ever get from normal vaccine trials, is what they're called. So the amount of people that signed up for this made the research that we got better and made us more confident in the information as well. And that's why we rolled these out quickly, because it turns out that the vaccines that they developed first they worked well, and we didn't have to go back to the drawing board too many times to figure things out. So. Yes, the blood clots from AstraZeneca and Johnson & Johnson. So before I'll start this slide, in case people haven't heard, today, May 11th, the province of Ontario announced that we were going to stop using AstraZeneca for now, until they reassess some of these blood clot issues and see how often they're happening, and whether the risk of them is worth the benefit of protecting from COVID-19. But that being said, the blood clots from AstraZeneca and Johnson & Johnson are still rare. The latest data from Health Canada, or from the province of Ontario, shows about 1 in 60,000 people might experience a blood clot. Originally, we were thinking around 1 in 100,000 people, but that's still quite low. To compare that, if 1 million people got sick with COVID, about 150,000 of them would get a blood clot versus 10 to 15 from the vaccines. So definitely far more risky to leave yourself exposed to COVID than it is to get the vaccine and protect yourself. But we might not see that. We'll see what happens with AstraZeneca in the future, and Johnson & Johnson as well. And time will tell, and more information will come out about those as we proceed. Other people are concerned about fertility and whether they can have families after they get the shot, which is absolutely something I understand completely. There's no evidence or data that these vaccines can cause infertility. They don't affect a man's ability to have sexual activity. They don't increase the risk of miscarriage in women. They're safe for people who are pregnant, and they're safe for people that want to have a baby in the future. We've been immunizing pregnant women in Canada, Chatham-Kent, Ontario, for a while now, and I don't believe that we've had many, if any, issues with that. And I do know recently during this third wave, there's been an increased amount of pregnant and new moms in ICUs with COVID-19. So definitely we'd rather see them get vaccinated. And we're also seeing research that shows that the babies they're having are getting some of that protection passed on to them when their mom gets the vaccine during pregnancy. So all great signs, and definitely not a reason to avoid the vaccine if you're planning on starting a family or if you have little ones. Now, what about if you're just nervous about needles? I understand that. Not everyone wants to get a needle. And I have a few tips for you if you're concerned about that, or some things that can help you when it gets to be your turn. So the first thing I like to tell people is just to communicate. Just talk to us, talk to the nurses, the paramedics. Let them know you're nervous. Let them know that you don't like to get needles. It's completely normal. They run into it all the time, and they probably have some great strategies that they could give you to help you get through the experience as well. The next part is just ask any questions you have about the shot or what to expect after. The people that are providing the immunizations and working the clinics are extremely knowledgeable. They've been doing this for months now, and they're really a wealth of resource and can give you the information that you need at the time to make that decision and to move forward through the vaccination process. So definitely communicate, Let them know you're nervous. Ask them any questions to help you feel better and answer any sort of lingering things that are bothering you. The next things that I like to advise people or to recommend is have a distraction, and think of that in advance. Something that you like to do, bring it along. If you'd like to read, bring a book while you're getting your needle. Bring headphones and listen to music if you can. Look at pictures, talk to a buddy, just something to keep your mind off of it while it's happening. And the last thing I like to advise people is just to look away. Try not to watch the person get the needle ready to give to you, and try not to watch them give it to you. Both of those things can help reduce the fear and get you through that experience. And the whole experience of getting the needle is really just 10 seconds. You'll sit in the chair for probably 5 minutes just talking to the person and confirming your information and making sure that you're healthy and that you're eligible to get the vaccine. The actual needle itself is only about 5 seconds or so. And it's over in a blink of an eye. And I overhear a lot of people at the clinic say, "Oh, it's over. I didn't even know it happened." So not to minimize your fears. I know fears of needles are real, but there's also some real things that we can do and that you can do and help yourselves get through it and get that vaccine in your arm and protect yourself, your family, and your community. So this was just a little bit of information, the most common things we hear about COVID-19 vaccines and concerns and questions. If you want more information, of course, we're going to have a question and answer session here, but we're always available at Public Health. No matter where you're seeking out your information on vaccines, please make sure it's credible. There's a lot of bunk information out there and a lot of half-truths, so please make sure you're researching using good information and good websites. Use our website, call us at our phone number, which is on the screen there. Use resources like Province of Ontario, Health Canada, World Health Organization. Those are the places you want to get your information, not from Facebook and Twitter and those places. So that being said, I'll conclude this part of the presentation here, and we'll move towards your questions, which are way more important than the presentation I just gave. I want to hear what you want to know, and I want to help you answer those questions and put your minds at ease. So.
Awesome. Well, thank you, Dan. As you can see here, we've already received some questions, so thank you for people who've submitted questions already. We've received some YouTube ones and on WhatsApp as well, so that's great. I think we'll start with our a very common question that we get every single day is, when can I expect to get it? So Dan, do you have any insights on how we're rolling out vaccines to our temporary foreign worker populations?
Yes, I do know that there's plans underway. We have teams that are working with the farms and arranging to bring the clinics to the farms. There are also other ways that you can get the vaccine if you can't make that clinic, but that's definitely your best way. So keep your ear out. Ask the farmer if he's heard any information about when the clinic might be happening. And our team's in communication. I think we have some planned already in the coming weeks. So we'll be getting out to you and getting you an opportunity to get vaccinated in the next little while. That's a great question, and it's a real fear. I understand. So yeah, like I mentioned off the beginning, maybe you weren't there to catch it, and that's great. Happy to say it again. You cannot be reprimanded. I guess the word they use is reprisal. There should be no reprisal for refusing vaccination. Basically, what that means is no, there shouldn't be any punishment if you don't get the vaccine. Now, that being said, there might be other things that might impact you because you chose not to be vaccinated. For instance, if you ever did get COVID-19, you might still have to quarantine. You might have travel restrictions depending on the countries that you're entering or leaving. And there's other things that we might need vaccinations to be able to do once we start to reopen things. So that's something to consider. As far as vaccine injury and compensation after that, that's a great question. It's not something that I'm 100% knowledgeable on. I would probably recommend that you would reach out to the consulate for whatever country you're from, or even, I don't know if the, any normal channels for some sort of workplace injury, or where you'd seek out sort of medical advice would probably be a good start. But as for the compensation piece specifically, I don't know if I can speak to that.
It looks like my mic stopped working. Dan, can you hear me all right? Is that all right?
Yeah, I can hear you, Jeff. Sorry.
Okay, great. So thanks for that answer. So our next question, and this is another frequent one that we often get. I'd like to get the shot, but I have concerns about my health. Can you still get it if you have some sort of disease or allergy?
Yeah, great question, and I understand the fear there. You don't want to put anything in your body that's going to make you feel worse, especially if you're not already 100% healthy. So I can get behind that. The short answer is definitely. We're currently specifically looking for those sorts of people. So the vaccination campaign we've been running so far has been focused on those with the most risk of disease. The people that are at the most risk of getting very sick or dying of COVID-19 tend to be the people that have other health issues, or age is another factor. So the bottom line is, the only reason you shouldn't get this vaccine is if you're allergic to any of the ingredients inside of it. Other than that, if you have any health conditions, get the vaccine. That's why it's there, to protect you. You want to get immunized so that if you get COVID, the disease COVID-19 does not, compound on top of your other diseases to give you a worse experience, put you in the hospital, that sort of thing. So absolutely, if you have other health conditions, I would line up to get that vaccination sooner than later and get yourself protected. If you have any other questions about it, certainly give us a call. If you have access to a healthcare provider here, I would recommend that. If you have any concerns about your health and safety with the vaccination for your own specific case, but in general, I think it's a go.
And just for the user who submitted that question, I think we just passed almost our 39,000th dose given in Chatham-Kent today. So we're almost at 40,000 shots administered. So lots of good has been happening on that front. Okay, Dan, our next question, is kind of comes up quite a bit, actually. If you're vaccinated, can you still acquire COVID-19, and can you pass it on to others? Now, I don't know if you have a good answer for this one. Am I right?
Well, it's a little tricky, Jeff. First, I'll say there's no vaccine or medicine in the world that guarantees it works 100% of the time. Okay. Every person's unique. Some of our immune systems are better than others. That being said, we know that these vaccines have very high rates of effectiveness, but we need to know more, like you alluded to. So there's still more research being done on this area. We're hoping that the vaccines will prevent the spread of COVID-19, whether that's preventing people from getting it or whether that's preventing people from giving it to other people. We're just waiting for a little bit more information about that. But I've heard early signs are looking promising, but I can't say any more than that at this point.
Okay. That makes sense to me. And I guess this really leads into our next question about, what happens after you're vaccinated and you're kind of exposed to someone, right? And I think Ontario is just really updating those kind of rules and regulations about quarantine for people who are vaccinated. And, is there more that you can add on that one?
Yeah, that's another one that's sort of developing as we go. Remembering that we've only been giving these vaccines, especially in Canada or in Ontario, Canada too, since the end of January, right? So we really only have 4 months of information to go on here. I think even globally they started giving them the end of November, so we're looking at around 6 months of information. So currently all of the same public health measures apply to everybody, whether they've been vaccinated or not. And that's just because we don't have concrete information to give us the go-ahead to say, no, you've had your shot, you don't need to quarantine. So once we get a little bit more of that information, see what's happening, how the vaccines are actually working in that way, then we'll be able to give a little bit more advice. But know that getting the vaccine will make your COVID symptoms less severe and will decrease your chances of getting very sick and maybe even ending up in the hospital. So that's a great reason to get it if you do get COVID afterwards, after you have the opportunity.
Okay, and I think that answer makes sense. It seems like we're getting a lot of information quickly, rapidly, because we really need to get a handle of this pandemic, right? We really want to return to kind of normal activities, right? And something you just said really triggered my thought here is like, you're going to get less sick, right? And I think that kind of leads into our next question here, which is one vaccine better or another? I think they all do one job really, really good, correct?
Yeah, they're all excellent vaccines at lowering the risk of serious illness, lowering the risk of death, and lowering the risk of ending up in the hospital. And those are the things that are really, really keeping us from doing what we want to do in society right now. Not that spreading COVID is not important, but really it's our hospitals being able to keep up. And the vaccines are all very, very, very good at doing that. Yes, there is a little bit of difference in efficacy, but we're talking about 85%, 80% efficacy versus 95% efficacy. So that's an A on your school report card, no matter how you look at it, as far as I'm concerned. And yeah, so people should really roll up their sleeves for the first vaccine that they have the opportunity to get. They're going to work very well, and they're going to do what we want them to do.
Did you say you got all A's on your report card growing up? Is that what you just said?
I'll have no comment on my report cards, Jeff.
Okay. We don't need to. You're not going to be sharing those tonight? Okay. So I'm just looking at some of the questions we have now, and there seems to be some travel related questions, and I know we have a lot of workers coming from all parts of the world, and this is kind of something that's going to kind of impact. I think COVID-19 has impacted travel. We have many regulations about people being allowed to come into Canada and getting on planes and going different parts of the world. This notion of the vaccine passport. What can you say about this, and where do you think this is going to impact definitely the workers in our community?
Yeah, this is an interesting one that I've been looking at as well. And I know that the Canadian Prime Minister Justin Trudeau has said expect vaccine passports in some way, but he didn't really elaborate on what that means. As far as travel, I would say it's probably definitely going to impact travel. Maybe not in letting you go where you want to go, but probably around requiring you to quarantine wherever you're going, depending on the rules of that country. So I think the rules are going to be a little bit different depending on where in the world you're going or coming from. And having a vaccination very well could make your experience much easier and better than not being vaccinated for the near future anyway.
Okay, and now we actually have quite a serious question, and I think it was a follow-up question to kind of the first one that kind of came in. And he has a number of children back home, and it sounds like he's concerned if he takes the vaccine and dies, what will happen to his children? Who will take care of them? Who will provide for them? And what would you have to say to this gentleman?
Yeah, that's a very, very serious question. And I don't want to minimize it, but I would probably say that the likelihood of dying from the vaccine is extremely, extremely low. And I really don't think it's something that you should seriously worry yourself about. If you're thinking about the blood clots associated with AstraZeneca or Johnson & Johnson vaccines, I mentioned earlier that Ontario is pausing the AstraZeneca program. Currently, Canada has not given a single dose of Johnson & Johnson vaccine. The vaccine will most likely be offering to our temporary foreign workers will be the Moderna vaccine, We're allowed to travel with it a little bit better than the Pfizer one. It's very similar to the Pfizer vaccine, and there's been little to no serious adverse events associated with it, along with very, very, very high efficacy. So,
and what can we say about the risks of dying of COVID-19? Like, I think that's what we need to bring into this conversation too, correct?
I think the numbers speak for itself. I mean, we see 20, 30, 40 people in Ontario dying every day of COVID-19, and that number is very, very low, if not zero, for the vaccinations. So I think that speaks for itself.
Okay, so let's talk about the process of getting vaccinated. If we can shift gears a little bit, Dan. You know, for many of us, we're kind of going out to farms. Some you know, and I guess what people want to know is what should they do beforehand. And so this question is about you know, what should I do to get prepared? Do I need to take any painkillers like Tylenol or Advil?
I wouldn't recommend taking them before your vaccine. If it makes you feel better, it doesn't hurt anything. You can still get your shot. But really, if you want to take Tylenol or Advil, I would wait and see if you experience any side effects, because you really only need to take that if you experience a side effect, and if the side effect's bothering you enough to where you think you need a little bit of relief from that. So, I mean, yeah, like I said, you can take it before if you want, but most side effects show up a little while after you get the vaccine, like hours after. And by the time they show up, the dose that you took probably won't be working anymore. So it's not going to affect the little pinch you might feel from the needle going in or anything like that. Take it if it makes you feel better. If not, you're absolutely fine. I wouldn't take it unless you start to experience side effects, and take it later on during that time to make yourself get through that period a little bit better.
Okay, and so to kind of go further, you know, so we're gonna, you know, not necessarily take any painkillers beforehand. You know, kind of wait and see how you feel, because most times the side effects, you know, maybe a sore arm. Most of the times it's nothing too severe. Anything else workers will need to bring or need to know beforehand?
Wear a short sleeve shirt. Makes it easy to get that shot in your arm when you're ready for it. Other than that, just know who you are. We'll ask you for your personal information so we can enter. We have a provincial database that we're tracking all the vaccinations in. So that'll let us know once it's time for second doses, who needs it and when they need it, which is important. If you have a health card or some sort of official identification, you can bring that, and we can use that to verify your identity. But that's not even necessary. We can provide vaccines to you with just your name and your birthday and you know, a little bit of personal information. We're definitely more concerned with getting you the vaccine than we are you know, making sure that everything's all 100% officially collected, even though we want to strive for very good information.
Okay, great. And so I think
and sorry, Jeff, I guess I'll just add, I gave those tips on what to bring to distract yourself. So bring that too if you want to read a book or listen to music or something like that. Yeah.
Great. And so I imagine that when our staff are kind of going to the farms, you know, it's things are kind of happening in kind of group settings with your coworkers and stuff, and you know, maybe not everyone's ready at that moment. And so what happens when we come to the farm and say a worker changes their mind? You know, can they still get it later? You know, what would you say to that question?
Yeah. So if we show up and you're a no and you change your mind while we're still there, come down and see us and we'll get you vaccinated. If you change your mind after we leave, I would recommend you discuss with the farmer, and they can have a conversation with us about maybe getting an appointment at the Bradley clinic if that works for you. Otherwise, if we're giving Moderna, we'll be giving second doses. Right now, we're giving them 16 weeks later. That might shorten up a little bit depending how the campaign goes. But you can always get your first dose when we're back for second doses for everybody else as well. But if you didn't get your shot when you had a chance and you change your mind, don't sit there silent. Please reach out to somebody, whether you call public health directly or whether you reach out to the farmer to have them contact us. We absolutely will do what we can to get you an appointment and get you your vaccine if you want it.
Yeah, and our staff are really friendly. I know they'll be very open to all your, your questions and concerns in the moment. And sometimes it's better to ask those things in person. So great. Um, so we have a question here about kind of local staff on site. Like I think we're only doing temporary foreign workers right now, but not local staff. Can you kind of explain the reasons behind that?
Yeah, so definitely. The reason why we're targeting the foreign workers specifically is more surrounding the living conditions. So the local workers, when they're done, they go home to their homes, to their families, whereas our temporary foreign workers often are living sort of communal and in bunkhouses in group living settings. And so that means that there is just a higher risk of COVID transmission just from living in a group of people together. And so that's why we want to come to you to make it easy for you, to give you that opportunity, and to make sure that you're protected early on in the season, while you haven't had a chance to live in those risky environments for too long. I know that last summer I was working in the same area as our case and contact tracers who call people that are sick and that have been in contact with people that are sick. And they had a few cases that showed up in bunkhouses, and they spread quite quickly through there. So definitely something that we want to help protect you from, and that's why we're coming out to give it to you, to make sure that you have that opportunity, because we think that you're at higher risk just based on your living conditions, not so much your working conditions.
Okay, great. So you just mentioned kind of second doses, and so this one, some workers have been vaccinated when arriving in Canada at the airport. Um, they some questions about when do we book it, and kind of what type of vaccine they will get, things like that. What can you say to this question?
Yeah, that's a great question. I'm glad you're concerned about that and that it's on your radar. That's great. And congratulations. Good job for getting your vaccine at the airport there. I don't know if you knew that you were going to be offered it or not, but I commend you and anybody else that took that vaccine when they got off the airplane. That was a great decision. As far as second doses, like I mentioned earlier, right now we're looking 16 weeks out, which is about 4 months. We're hoping that window will shorten. I understand they're giving Moderna at the airport, which is what you reported in your question, and that's great. So we will make sure that we get you a dose of Moderna for your second dose. The information for when you got your shot at the airport should be entered into that provincial COVAX software that I mentioned earlier. So we should be able to find your information and find the date you got your first shot and make sure you get your second shot appropriately. It wouldn't hurt maybe to reach out or have your farmer reach out and just maybe provide that date that you've been vaccinated, and maybe for sure keep that date in mind yourself, and then we can keep an eye on that 16 weeks to make sure we're getting you that shot in time. And like I said, hopefully the vaccine supply picks up enough to where we can shorten that window from 16 weeks down maybe to a month or two, and make it much more likely to get people their second doses in a much more timely fashion.
All right, and I actually have another message texted in here on WhatsApp. So why don't you take a drink, Dan? And I want to. So thanks to the person for submitting a question. He's actually got a couple that I think that you've kind of answered. So he's asking about kind of symptoms after taking the vaccine. So you kind of cover that context already.
That's okay. I can run through those again if you like.
Sure, do that real quick.
Yeah, sure. So the most common symptoms are things that you might experience if you have a cold or a flu, or milder symptoms of COVID-19 themselves. So that's things like fatigue or feeling tired for no reason, muscle aches, body aches, low-grade fever, headache, and maybe a little bit of redness or soreness where you get the needle. Other than that, extremely, extremely rare side effects could be an allergic reaction, and they would happen almost immediately. And like I mentioned in my presentation, we have nurses and paramedics and medicine and equipment on site to deal with any of those. They are 1 in a million, but we're ready for the 1 in a million. So we're hoping
Excellent.
It doesn't happen, but if it does, we'll take care of you.
Great. And so he's also asking, after he gets vaccinated, will he be able to work afterwards? And I'm imagine, physical work, what? What would you say to that?
Can you repeat that question again, Jeff?
Yeah. So after vaccinated, will you be able to work after being vaccinated?
Meaning, like, if you feel a little bit ill?
Yeah.
Yeah. So, I'm not exactly sure what the specific policies will be recommending to the farmers are, but I know in some of the other settings, for instance, I helped out with the long-term care rollout for our seniors' homes, and so they're kind of operating under the impression that people might feel a little bit ill, and it's okay to continue for a day or so. But if it continues past that and it's not getting better, then we would initiate an isolation and a case investigation. And if it is getting better, then it's likely just a side effect and you can continue on, and there's no issues there. So it's kind of a case by case, see what's happening. Do we think it's the vaccine side effect, or do we think it's actually COVID-19? And it takes a little bit of investigation work sometimes, but just pay attention to how you feel, and if you're starting to feel worse or better, and we can help gauge it from there.
Okay. So thanks to Nicholas for sharing one of his questions earlier. We really appreciate it. So this question, I think, is reflecting on the news today around AstraZeneca vaccine, and it's kind of referencing Johnson and Johnson, which I believe they're a similar type of vaccine, if that's fair to say. So what happens if you take a vaccine and it's kind of recalled or paused with your first dose? Do we know what's going to happen with the second dose? What will happen now?
That's a great question. So right now, I'll just talk about the AstraZeneca news from today, perhaps, and what we know about that.
Okay.
So the province paused the use of AstraZeneca today. They found that the blood clot issue was showing up a little more often than they thought it was going to, or that it was in the UK. So out of an abundance of caution, we're just going to pause that program right now, have a little bit better look at the numbers and where they're coming from, and see whether it's worth the risk. So we always have to weigh the risk of a side effect from a medication or vaccine versus the benefit that it gives us. So we have to figure out if the risk of 1 in 60,000 people, or whatever the number is, getting a blood clot, does that outweigh the risk of people getting COVID-19 and dying? And that's what's been posed to our experts at our tables at the provincial level right now. So they've paused the use of AstraZeneca, means we're not going to give any AstraZeneca right now until they find out more information and relay that on to us. So there's a few things they're looking into about that. A lot of people got AstraZeneca in the UK, and they're showing that people that did very good with their first dose tended to do very good with their second dose. And so we're just looking to see if we can make those numbers align, and if we think we agree with that, and we'll probably let or offer second doses of AstraZeneca to the people that got first doses of AstraZeneca. What they're also looking at is, if we do a first dose of AstraZeneca and then we switch and we do a second dose with, say, Pfizer or Moderna, does that give us the same level of protection, or is that not a good thing? So there might be a couple options for people that got their first dose of AstraZeneca. We're just kind of waiting for more information to see what that is going to be. I wish that I could give a more concrete answer right now, but I would rather wait for the real information than feed you a bad answer.
Okay, because they are talking about the interchangeability, right? So that potentially is something that's being explored. If I got one time, can I get a different one the next time?
That's right, yeah. And
Okay.
I think that would be ideal and probably put a lot of people at ease that have had AstraZeneca already. So we'll see if that happens or not.
Awesome. So our next question talks about kind of the risk of not being vaccinated when everyone else in the bunkhouse is. What can you say about that?
Well, you might not be at more risk of contracting COVID, but you won't have that protection from severe disease and hospitalization that you would have if you got the shot. So having people around you vaccinated is really good if you can't get the vaccine. If you're allergic to it, but everyone around you can get the vaccine, that's very good news for you. You're protected when you're around those people. So what I think that means is that if you are healthy and you don't have any allergies and you can get the vaccine, I think we have a responsibility to protect ourselves so that we can give that protection to the people that can't get it for a real reason. So that would be my message. That, yeah, even though everyone in your bunkhouse might be vaccinated, you might not get COVID from them. You are still going to be in situations, whether it's working next to the people that don't live in your bunkhouse or going to the store and coming in contact with someone with COVID, or anywhere you might be that's not in your bunkhouse, you're going to be still at risk for COVID. And then, like I said, if you do catch it, you won't have that protection from severe disease, maybe going to the hospital, or maybe worse.
Great answer, Dan. Thank you very much. So it looks like we got about 2 more questions left that we're going to get to, and so we'll ask the next one now. I like this one here. It really talks about kind of what's happening in Canada and kind of all the different places in the world where people are coming from. All countries are kind of vaccinating at different rates, correct?
Mm-hmm.
And so can't I just get it in my own country when I go home? Do I get it now? What can you say about that?
Yeah, that's really a personal choice that you'll have to make. Depending on the country you're from, they might be giving vaccines that we're giving here. They might be giving different vaccines. I don't know what's happening in every vaccination program in every country. But if you want to be protected while you're living and working here this summer, and if you want to make sure you're protected for your travel home to protect your family, I would recommend getting it here. We're offering our temporary foreign workers currently the Moderna vaccine, which is a great mRNA vaccine. And if you get it at your first opportunity, the chances are good that you'll still be here for a second dose before you leave, and you'll be able to go home to your home country with all of the protection of the vaccinations, and knowing that you're not going to bring it or contract it on the flight and bring it home to your loved ones. But definitely a choice you have to make for yourself, depending on the situation in your home country and your feelings on the vaccinations.
Now, I know Dr. Colby says this a lot because I think the other question the follow-up question we have is, what is the difference between the first and second shot? And I think Dr. Colby says the first is for strength and the second is for length. Could you elaborate on that for our viewer right now?
Yeah, that's exactly right. So just to repeat that, the first is for strength. So that gives us the most initial protection from the disease, and it usually lasts for a shorter period of time. And then when you get that second booster dose, it sort of jogs the memory of your immune system and makes the response, it strengthens it a little bit, but it helps extend the amount of time that protection lasts for. Now, we don't know exactly how long the protection from these vaccines lasts. We're still working that out. Of course, like I mentioned, we're about 6 months into the campaign worldwide. So far, we're not seeing an indication for booster doses beyond those second doses, but that might be possible in the future. We'll see. But that is the main difference. So the first dose gives you the most protection for a shorter time, and that booster dose enhances it a little bit and makes it last longer.
Okay, and so the worker just messaged us asking, is it going to be a yearly shot? And you kind of answer that there, but can you kind of say it again?
Yeah, it still remains to be seen. So we're about 6 months into the campaign worldwide, and we're always looking at information. Exactly the reason why we paused AstraZeneca today is because of the safety systems and the monitoring systems we have for our vaccines. So we're always looking at the information and making judgments and giving advice based on that. So I can't comment for certain if it'll be a yearly vaccine that people will get, or if it'll be every 2 years, or if we'll see the end of this and never have to get it again. We'll have to wait and see what the story tells us.
Okay. Yeah, and I think we have someone is really concerned about kind of the dosing schedule, right? So we know kind of strength and length, and we'll learn more as we go along. Right now in Ontario, it's at 16 weeks or 4 months.
And really, Jeff, that was based on what we were seeing around the world. So when we made that decision to extend our doses 16 weeks, the world was about 4 months into the vaccination program, right? So I think the UK started in November, and we changed our recommendation in March once we saw that those people who had first doses in UK still had really good protection at that time.
Mhm.
So maybe their protection lasts longer. Maybe it is actually good for 6 months or 8 months, but we really just don't have that information yet. So we know, we're confident that the first dose gives good protection for at least 16 weeks. And the decision for lengthening that window was to allow us to give more first doses to people, to give more people that strength shot to be able to protect more people and maybe bring COVID to an end earlier. And then, so just now in the next few weeks, we're starting to give second doses to people that were vaccinated back in February and March. So we're definitely working our way through it. And as we get more vaccine, hopefully we can work through it a little bit quicker. And hopefully you won't have to wait until July for your second dose. But rest easy right now knowing that we have good information that tells us that your shot is good for longer than a month and you should have your protection until you're due for your second shot in July.
Okay, well, I think that's really good. I think our final question of the night is, there's nothing 100% certain in life, right? With anything, how do I know the vaccine won't affect me in a negative way? I don't think we can. You've already said it tonight, right? Nothing is 100%.
That's right. Yeah, there's a lot of different sort of factors that go into that. And a negative way could mean different things. It could mean like, am I going to have a headache after? I mean, maybe, probably I could say, because it's a common side effect. I'll say I have heard that, especially with the mRNA vaccines, it is common for people to have side effects. Maybe not all of them, maybe one or two. But to say that you're going to have a serious adverse event, I can say is highly unlikely. Extremely unlikely, actually, but I can't make a guarantee. I don't have a crystal ball. Nobody can make that guarantee, right? But just know that the odds are in your favor that you're going to be fine. You're more likely, I would say you're probably more likely to win the lottery than you are to have a serious adverse event from a vaccination.
And we do know the consequences of what happens when people get sick with COVID-19, and that's really what this comes down to, is we need to prevent people from getting sick from something that we now have a tool to prevent this. And if we all do our part, we can really protect ourselves, our families, our community, our coworkers, and I think that's kind of really important. So
that's right.
Okay.
Yeah,
so
if you're not going to do it for yourself, at least look at those around you and hopefully do it for them.
Okay. And so I'm just going to add in the chat box right now. I really appreciate your efforts tonight, Dan, to kind of answer these questions. Kind of putting you on the hot seat here. I think our lights even went out for 5 seconds because the questions were getting intense. But so thanks for your time and efforts tonight. We really appreciate it. We have created a special temporary foreign workers web section of our website, and so the link is in the comment section. So if you have questions or comments or concerns, feel free to kind of look there. We have information in a whole variety of different languages for you. If there's something you need help with, please reach out, and we have translation services that we could, our staff can kind of work with you and to help support you. Is there anything else you'd like to share tonight, Dan, before we sign off and go on to the rest of our evening?
Just watch for our vaccine clinic. Come into a farm near you and roll up your sleeve and get vaccinated.
Great. So thanks again. Thank you for everyone who submitted a question, a comment. We really appreciate it. And we'll see you again shortly soon, where we're going to do this again. A Spanish version of this will be coming Thursday night. So so I look forward to hearing you speak Spanish, Dan. It'll be great. No, you're not.
I'll have to take a crash course over the next 2 days,
yeah,
I guess.
No, so we have some support coming, which we look forward to their help. And yes, so thank you everyone for joining us, and please have a good evening.
Thanks everyone. Have a good night.
Bye.